And here are the digestive enzymes. There are 3 varieties here, plus a plant variety called bromelain. 3 animal varieties, 1 plant variety. The amazing feature of all cancer patients is that they don't digest their food. They digest less than half. Often you can see it right in the toilet bowl, that you've got bits of food in there. And it's because the pancreas isn't secreting, the stomach isn't secreting, the liver isn't doing its job. Altogether, you can't digest. And then you have a lot more to feed your bacteria and parasites. And depending upon what you're eating most and not digesting, that's what decides which parasite will become major.
And on top of that, cancer patients don't have much appetite.
Right.
Yeah.
Right. So they're going downhill with all of their metabolism. Not enough food, not enough digestion. But mostly the digestive problems reside right in the organ. First off, way at the beginning of the cancer, you find an indigestion, burping, feeling uncomfortable at the end of a meal.
Bloating.
And it's because salmonella has gotten into the pancreas. It's that simple. Salmonella gets into the pancreas very easily because the duct to it is right across from the bile duct, very close. And you know, the liver is a pretty dirty place. It's always full of salmonellas and other bacteria. And so they just cross over into the pancreas, and if you let them set up shop there, then they will reside there and start invading the rest of the pancreas. And pretty soon, there are parts of your digestive juice missing. No chitinase. And how are you going to digest yeast? Your bread is full of yeast because you put it there, and the yeast has walls, and that's made of chitin, and you can't digest it. But many other parasites and bacteria can, and so they'll do the job for you. You are feeding them instead of yourself. So it's important to kill the salmonella in your pancreas. It's mostly salmonella, not E. coli, that gets there until you're very sick. Then both of them are in there. And of course, the way you kill salmonella is already the way we discussed here with these protective supplements. Lugols, you're not limited to 4 times a day. You can do it 6 times a day because you're out to kill salmonellas. And before you know it, in maybe 2 days, you've got the salmonellas in the pancreas killed. That's incidentally how all diabetes starts too. Salmonella in the pancreas.
Really?
And then you can't digest very well. And that then allows yeast and other things to settle in the pancreas too. And that's how the problem grows for it. We're here discussing these digestive enzymes. And because you can't do your own digesting, you need to help your digestive tract, help your digestive system do the digesting. And there are alternative methods based on this almost solely, so that if you were to take 75, let's say, digestive enzyme capsules in a single dose 3 times a day, you could save yourself just by clearing up your digestion and feeding yourself again, and allowing yourself to get your energy back to where it can kill the salmonellas on its own. So what we do is we give you pepsin to help the stomach, multiple digestive enzymes to help the pancreas. That's where the exotic enzymes are, like arginase and chitinase. And then the pancreatin lipase is the big heavy-duty digestive enzyme. It's a mixture of enzymes. The lipase digests fat. We're all full of fat because it's hard to digest. And we were told that this kind of oil and that kind of oil was good for you, and so we overdid it. But how should we know that we can't digest it? So we have little bits of oils all over the body, doing nothing but attracting viruses. It's the viruses that thrive on your oils. And that's why we cook without oil. We use only butter, which they don't use. Because when advanced cancer patients arrive, they are full of viruses coming out of their parasites and bacteria. It's one big takeover that's happening to the cancer patient, where other things are taking over their body. So the fastest way to stop all that is not to feed them. Killing them is much harder. It's much easier not to feed them because they disappear on their own, and you don't have to take care of the garbage that's left over after you kill them. You don't get detox symptoms from starving your parasites and bacteria. So it's a very good method.
Right.
I mean, you can read more about it in the book to find out how that works. I have a table there of what each bacterium or virus needs. And if you don't feed them that, you'll have them killed down to 1/2 their size in about a week and just essentially gone in 2 weeks.
Wow.
Bromelain is very useful because it'll do a bit of all of the jobs of the pancreas and the stomach and the liver. So at one time we were giving very many pancreatin lipase tablets, like 15 2 or 3 times a day, which isn't really very many yet in terms of enzyme. But we don't have to do so much now when we go at it this faster way and rehabilitate your own digestive capability. But still, it would be a good idea to take much more digestive enzyme to help the body clean up, because there are deposits, residues. Breast cancer patients, for instance, are so full of oil that it takes a week for you to catch up digesting that.
Wow.
Especially the kind of oils like soy oil and a substance that goes with it called apiol. And apiol is the cause of breast cancer because that's what inflames the breast in the first place to invite the parasite and carcinogens over to it. Any inflamed organ is open. It invites whatever shouldn't be there into its tissue.
Wow.
And that just leaves this large dose of pancreatin lipase and this vitamin A drop, which is easy to do. Again, that needs to be poured into a dropper bottle if it arrives with a glass or rubber tip. And then finally, bedtime. And if you can't sleep, it's because you're full of E. coli and salmonella. That's what does it every time.
Bacteria in the brain.
You're so full of them, they're swarming in your lymph and blood, and not so much the blood, that's kept clean, but the lymph is just swarming with them. And it gets up into the brain, and in the center of the brain you have a little gland called the pineal gland, and that's what makes your sweet substance. But it's a favorite place for bacteria to enter the brain. That's why you have a large number of brain cancers that start right there beside the pineal gland. A little abscess forms or something like that. And so the what corrects the condition, and you can correct an insomnia of the worst kind in 2 days, just by killing E. coli and salmonella and not putting one thing in your mouth that has those bacteria on it. Washing your hands, not putting your hands in your mouth. All the food has to be sterile, and we do that here. Food has been frozen before or after in order to sterilize it, and at home you can use some other method, but freezing is still the handiest. That way you will be getting rid of the 2 bacteria that cause insomnia. And then as a little help, you can use some extra melatonin here and some ornithine. Generally 9 capsules of ornithine is what it takes if you can't get rid of the bacteria. 9 ornithine, and 2 melatonins, or even 3 of 3 milligrams each. And all of that has to be sterilized too, because the melatonin and the ornithine will itself be bringing E. coli and salmonella
wow.
unless you sterilize it.
Wow.
So you see, it all really boils down to fairly simple things that a nurse could easily handle and advise.
Mm-hmm.
And I'm hoping that all of society becomes neighborly and helps each other get out of this cancer scourge, and especially helps with the water issues and cleaning up the house, and how to get rid of the cancer they already have just by sweating it out. I hope that inspires a lot of people who are in therapy types of professions themselves, with massage or some other kind of therapy, that because they may be therapists at heart, and now they can be so successful with our worst disease.
Then if they learn to use a synchrometer and test, they could be
By all
monumentally
means.
successful.
Yes, they can learn here in 2 days. 2 days of only 3 hours each. That's not very much learning time.
Mm-hmm.
And and I think that we have an excellent teacher, and I think the advantage gained can't even be counted in monetary terms.
Mm-hmm. Well, thank you, Dr. Clark. That was exciting and very, very informational. Thank you.
You're welcome.